Well, good morning, everyone. Thank you very much for being here. New location, so we're still figuring out a couple of things, and I think maybe a few other people are figuring out how to get here, I'm hoping. So we'll probably have a couple more come in, but I think for purposes of time, we'll go ahead and get started. My name is Mindy Tueller, and I facilitate these meetings, and I'm also the manager of the Medical Home Portal, which is a tool that we use on a regular basis in these meetings. And so we always like to start the meetings off with an introduction. And so if we can go ahead and do that now, just take a second, we'll just kind of go around the room and tell us your name, your organization, and maybe your role in there. And that way, for some of those who are newer to this group, we'll get to know one another. So Kim, do you mind starting?
You were looking at me.
I was.
Yeah. Hi, I'm Kim Bloom, and I'm the new QI coach with UDAC, working with Gabby and Dawn.
I'm Dawn Bentley. I'm also a new QI coach with UDAC. I'm Becca Barker. I'm the care coordinator at the University Pediatric Clinic. Athena Parker. Care coordinator with University Pediatrics and also the Developmental.
Cindy Kelly, grew up with pediatrics and medical for pediatrics, care coordinator.
I'm Eric Christensen with Utah Department of Health, Bureau of Children with Special Health Care Needs. I manage our integrated services program.
My name is Adam Beach, and I am a health advocate for the Health Rights in Pediatrics.
I'm Melania Widow, and I work with the University of
Nancy Cunningham, University of Utah Health Plan, Pediatric Care.
Scotty Barbagoshi, I'm one of the QI coaches, and also working with Cindy.
Janice Lucky, care coordinator at Bureau of Children with Special Health Care.
All four of us children with special health care coordinator.
Marilyn House.
Same group, care coordinator.
Anthony Arcada, care coordinator with Children with Special Health. I'm Heather Carlson. I'm a nurse care coordinator for Children with Special Health Needs Integrated Services. We all work with Eric, and Tony and I are in the office.
I'm Jenna Dolores Evergate. I walk at Pediatrics and St. Mark. I'm Carly White. I'm the nurse care manager at Holiday Pediatrics.
I'm Katie Haynes. I'm with the portal, the medical home portal, and living resource.
Doug Garland, health nutrition and director of UDAC.
Chief Colomani, Utah Family Voices. Can I do a couple of housekeeping?
Yeah, of course.
Just in case, men's bathrooms is right across the hall right here. The women's, you have to actually walk around, and you can either go through this larger conference room or around. Staff from Family Voices and Parent Center will start trickling in around 9. So they'll just wave to you and know that you're here. This is a new, of course, see how we kind of want your feedback too on what it takes to get here, if it's easier or harder, or because Chuck wasn't so sure it was going to be easier getting here, but because I'm here 3-4 days out of the week, I think it's much easier than going out the other day.
Oh, no question related to primary children.
So, and just for, and of course, we have the coffee and all the goodies that people have made. There is also hot water as well if you want tea or hot chocolate. So, thank you.
Judy, can I ask a question? And this is the cheapskate in me speaking. If I park out in the lot, the validation lot.
Okay. So I'm glad you brought that up. So all of you, there will probably be our wonderful guard out there when you leave. I will be getting each one of you a validation as you go out. Even if you got here before she was there, and I will still give you one to go out.
Yes. Yeah. And so whoever is on the line, do you guys want to introduce yourselves as well? Maybe unmute first.
I'm Alexa Jarrett. And I'm the care coordinator for Willow Creek at Draper. I'm only going to be the care coordinator until October, and then our new clinical manager is going to take over.
We're happy you're on the line. Thanks, Alexa.
Thanks.
I'm sorry, I can't see who's on the line.
Oh, it's Kim Orton.
Good.
She just writes that, sorry, just on the computer, I think she cannot talk.
Okay, well, we're happy you're with us too, Kim. Kim, as many of you know, is with neurology, pediatric neurology, and she's in the Echo patient building. So she's where we would normally be this morning. And so thank you very much to the Utah Parent Center and Utah Family Voices for allowing us to use this. So as Gina sort of indicated, this is a test. They are nice enough to allow us to continue to use this space going forward. So we want your feedback. How was it getting here today in terms of kind of, rush hour traffic and so forth? People are nodding, that it was all right, it was fine. Loved it, okay, good. Yeah, and I didn't have any problems either, so we know that school is about to start, and that impacts getting to the university even more for many of us. Some of us, of course, were right up there, so I apologize about that, but we're continuing to try and find the best location that meets everybody's needs and at least most everybody's needs. So that's why we're here. And if we get continued good feedback about it, well, I think we'll just continue to meet here and not keep switching places, so we can kind of dial it in. Okay, just a couple of other things and then really get started. So I wanted to let you know that I have been trying to put all of our meeting recordings on a YouTube channel that's specific to this group. And so in theory, we would be able to put other things there as well, but that's what I've started to focus on. So when we send out the resources of the month email today, or rather in the next day or so, that link will be on there for you. Those are public. On the screen, yeah. I can't see that. Having some more difficulties. Let's see if I can pop out of here. Okay, don't want that. That down. That gremlins. There we go. Okay. Great. So that link will go out, and those are public videos in that you don't need to be logged in or anything like that to see them. And then we talked a little bit last time about trying to have kind of a dedicated website that might include a number of features like a calendar and links to meeting agendas and things of that nature. Maybe even have a kind of a bulletin board or a forum type of feature that would allow you guys to talk with one another in between meetings and raise questions and ask for help in a way that maybe we could go back and look at those later if somebody else had a similar question, that it would be captured somehow, maybe even categorized. And there's a lot of software out there that does this already. So I've been researching that, and I think we have an idea of something that might work for us. So now we're going to play around with getting it installed and seeing how that might work. So I just wanted to let you know that we continue to work on that, and with a little bit of luck, by next meeting or prior to next meeting, we'll have that in place to start testing and playing around with. And what it would do is give you the opportunity to see the contact information for the others in the room and contact that person directly through the forum or through email if you had a question for a single person versus the whole group. And so give us some flexibility in that way. So that's that. And then we talked a little bit about the Utah Parent Center meeting location. So now let's jump into our brainstorming session. So does anyone have a case or an issue or something that they would like to bring up, and maybe we can work together to figure out if we can find an answer, find a solution? Anyone running into some problems finding resources for their families? Everything's going smooth. That's what we like to hear. It's all good? Oh, okay.
Okay, I don't have not necessarily a problem with a question if you really can answer it. We have an 11-year-old that is probably autistic, but has kind of not fallen through cracks. I don't know. Is seeing a therapist who now wants her tested for autism because they're pretty sure she has it. Is that one that we can refer to the Child Development Clinic? They're 11.
So nice that Lori just walked in the room. Sorry to put you on the spot. So this is Lori Lesher. She's from the University Development Assessment Center. And so, Lori, the question was, if there's an 11-year-old who is suspected of maybe being on the autism spectrum, would she be the right person to, or rather would the UDAC be the right place for her to be assessed? Absolutely. Okay. At that age. Great. Super.
Yeah, we're going to see kids up to about age 21. Is that the same as the child development clinic?
Yes.
Okay, child development, yeah. Okay, so we don't have the MChat and that to send, we just simply send the referral with that information. If you have that information and it's been done, so we want to see anything that's been done, so we don't duplicate efforts, but, right, if you don't have it, and there is still 700 people out. We are a lot of people out, not that many, but, several hundred. Yeah, okay. Cool, thanks.
When you say out, you mean waiting list?
Yeah, we have a long waiting list right now that we're chopping with.
So clearly, this is a good topic to be getting a presentation on today. So we're very excited about having these two organizations come and talk to us today and help us understand kind of where things are all at currently and where they're heading in terms of clinical and other services. That's great.
And you said that you would take cases to 21.
Okay, and Jenna, did you have a question?
Yeah, I have a patient who's 16 and she's got some developmental delay issues and things like that, but she is going in, I think she's having corneal transplant surgery today, actually. Mom was trying to look into like a rehab facility because this girl just picks and touches and she's going to have ankle surgery soon and then have ear tubes fixed and things like that. So Mom was looking into like a rehab facility so she could go there and have 24/7 around the clock care, but we can't seem to find a place. I was just wondering if anybody knew of any places that had that kind of care or
Where is she?
they live in Tooele, but they're in Salt Lake all the time.
Okay.
Well, if I can interrupt, I think she might be one of my, she has Healthy You.
Yes.
Yes, and I actually care manager. She just came over and became effective just this past month. So I can talk with you because maybe we can look at South Davis, maybe for an interim time for her to go in and we can talk.
I like that.
And so maybe remind us about South Davis.
So if, I can speak for Healthy You, but generally if the child meets medical necessity and there is need for some respite, there can be a 5-day period, and sometimes it can be looked at longer for them to go in and have that medical attention addressed. And with us having care managers for these kiddos, if we need to look at an angle for a benefit exception, because there are a lot of other social or a lot of other conflicting factors, and we can talk about that and present that to our medical director.
Another win for this meeting. It's important to have these opportunities to talk and connect, isn't it? And so that's, we don't want it to just happen one time a month, and then it only happens if you happen to make it and bring up the topic. And that's why we're hoping to create some sort of a space online that allows people to have those questions and put that information out there in a safe place. So
Well, the other thing that I would like is if anybody has business cards, to change.
great. Yeah, that's a good idea. Excellent. Hey, anybody else?
I don't know if this can even be approached here. I have a young man who previously thought we carried a dual diagnosis of ADHD, got ODD, and is thought to have an autism diagnosis, was recently re-diagnosed and thought not to. This is a young man who is very aggressive, when he gets pushed in a school situation. When he was a preschooler, he assaulted a younger girl, got kicked out of his preschool. You probably saw it on the news. Every year there's a repetitive cycle of him being aggressive. Last year, paramedics were called to his school. It took 5 adult men to do him, and they gave him an IM injection. He went to the ER, but by then he was so subdued because of his IM injection. He was calm, and they released him. The young man really needs some more intensive therapy, but we're stuck in a system, so he has Medicaid. So in Davis County, they have to go through Davis Behavioral Health. They don't provide day treatment there for that age group, but I cannot, since the dollars go to Davis Behavioral Health, they will not approve him to have day treatment in another facility that offers. So I don't know if any of you guys know, there's a new place in Davis County that opened up. It's called Matt Place. It's for autism therapy, and they also have a day treatment program primarily for autism, but they do other mental health needs. But because Davis Behavioral holds the dollars, they won't approve him to go to this place because he no longer carries an autism diagnosis. Anyway, we are going to have a care conference with them, but they see him as well managed. But you will see him on the news again if somebody doesn't step up therapies. Does anyone have any ideas of how you can push a system to provide care that they don't feel? I don't know. I don't know what I'm asking for.
You know, I had the opportunity to talk with the head of Davis Behavioral for another project, and I guess based on what I heard, which was definitely high level, I'm a little bit surprised at what you're saying, and so I'd be very happy to reach out to him and just maybe I could get a little bit more information from you and try and ask him with the high level, not personal information, what his thoughts are on that. Because my impression of Davis Behavioral is that they have just a ton of different options.
Well, they have parenting classes, they have, but they don't really at his age group have a day treatment or an after-school program for him, and it just kind of falls on deaf ears. I feel like that, they say, well, he hasn't had an outbreak in a month. Well, because he's been in a recreational program all summer. Now he's back in school. Right. Second day back, we've got someone that was injured, by this child.
Well, I'd be happy to follow up with you. I don't want us to convince the system, but based on what I heard from him, and I really, this doesn't sound quite accurate from what he was telling me that they offer and want to do. So
it's hard when we can only go to one place, and yet they don't offer it, and yet they won't approve it for another. Right.
How old is the child?
He's 9, but he's the size of an adult. He's a big boy. He can cause harm.
Does he have one-on-one supervision?
He does not.
That's the thing that they can have.
Maybe, but that's what I was going to say, is it sounds like they need to get the IEP team together now, look at the behavior plan, and also look at some potential after school and working with either a community environment. Because with Davis Behavioral Health, even though they're saying that, really, you can't fit them in a box. I'm surprised that they're saying that you can't have day treatment if that's what the child needs. And it is a tricky system because of the carve-out for mental health, but it sounds like maybe the first steps are, because he's going to be spending the majority of his time, and you don't want him kicked out of the school environment, or then the parents really have this issue of no place to go during the day. Right. And if that IEP meeting requested pretty immediately and talk about that behavioral plan and what resources they can offer afterwards. Tricky. All right, anybody else? This is good timing, so we'll actually segue now into Eric's presentation. So as Eric mentioned, he's with the Department of Health, Bureau of Children with Special Health Care Needs, and over the Integrated New and coming together, Integrated Services Program, of which the 5 folks from the after there are all right, so let's see what other challenges we do.
We have liftoff. Doesn't help either. I can tell I've got middle-aged eyes as I'm trying to look at this screen. So, I'm delighted to be here this morning and do a quick presentation about the Utah Department of Health, Bureau of Children with Special Health Care Needs. Let me just introduce myself quickly. My name is Eric Christensen. I have worked for the Department of Health for almost 16 years in just another month. I started out with Department of Workforce Services, and I was a case manager for child care, food stamps, TANF, all of that sort of stuff. Did that for about a year and a half, and then I went to the Utah Department of Health, Bureau of Children with Special Health Care Needs, specifically the neonatal follow-up program. Worked in that program for a lot of years, and in the last couple of years, I managed our clinical services program, which included the neonatal follow-up program, child development clinic, itinerant clinics, and the specialty clinics, which was programs like orthopedics clinics that traveled throughout the state. So, my question to you would be, what do you know about the Bureau of Children with Special Health Care Needs, and have you had any interactions with children with special health care needs with the Bureau?
Sugar Provo office.
We'll talk about that in just a few minutes. All right, let me just name some things quickly, and then we'll go over a more extensive list of what the Bureau of Children with Special Health Care Needs currently still provides. If you've had any experience with newborn screening, so field stick, so babies that get a field stick, usually go in the hospital and within a couple of weeks post-discharge. Hearing screening, so early hearing detection and intervention program. Also, cytomegalovirus screening is done through that. So a lot of different things that you may have had some contact with are actually handled through the Bureau of Children with Special Health Care Needs. And this is just critical congenital heart conditions, the blood spot, and the hearing detection, as I mentioned a minute or two ago. I wanted to give you guys a little bit of history about where Bureau of Children with Special Health Care Needs comes from. So let's look at 1912. 1912, the Federal Children's Bureau was established, and its goals were to provide a uniform birth registry, certainly useful, and we've all benefited from that throughout the years. The school lunch program, they worked very much on child labor laws, with making sure that children were not working, hours that they had worked through the Industrial Revolution. And then they also set some maternal health standards. Come 1921, the Shepherd Counter Maternity Infancy Act came into place. That was in place for approximately 8 years, from 1921 to 1929, and it provided the first public grants to states for some public health initiatives. Certainly, it tugs at the heartstrings of the public to work with children, especially, and expectant moms, and so it's easier to place funding for those groups than for some other groups. So that was kind of a big public health kickoff back at that time. Interestingly, though, it was considered controversial and socialist. Our current environment with possible socialist candidates, that theme revisits itself through the years. That was repealed, though, in 1929. Interestingly, though, 47 states during that time had programs that were developed that are still in existence today. So the proof in the pudding, I guess, through the years is that some of these programs, even though developed in the 20s, were kind of on the cutting edge and still remain that way to this day. Certainly priorities to the public. We hit the miraculous year of 1935. Does anybody want to venture a guess why that is an important year? I'm not a great historian, I got to tell you. I somehow managed to pass an AP history exam in high school, and it's anybody's guess as to how or why that happened. 1935, what was going on during that time frame? Okay. Not where I was going with this, but okay. Anybody know what was going on in 1935?
We just post-Depression?
Middle of the Depression. Actually, it was from 29 to 39. So 1935 was a very important year because important legislation took place. Anybody want to venture a guess on what that was?
The New Deal?
Part of that New Deal, lots of stuff going on, lots of public works projects, lots of stuff happening. We'll give you a little cheater picture here and see if that helps at all. What was that? No. Okay. That's good. Public health perspective, I like that. Polio, penicillin, all that good stuff. So we have FDR, and he is signing into effect the Social Security Act. So I just wanted to go through some of this really quickly, and then we'll talk a little bit more. Social Security Act was put in place, and Title I is for old age assistance, and just so you know, they appropriated $49,750,000 that year for old age assistance for the entire nation. Title II is the old age reserve account, and fact about that is that's talking about benefits that would be paid to people, and it was to not exceed $85 a month. Now, my mom receives Social Security now, and she'll tell you it probably hasn't gone up much since $85 since 1935. So, the child talked to me about being on a fixed income. So, anyway, Title III was the unemployment compensation. Title IV, aid to dependent children. You would receive $18 a month for your first child, $12 a month for each additional child. So it was really to your benefit to have lots of kids and get that $12 a month. Interestingly, minimum wage that year, there was none. 1938, 25 cents an hour was established as the minimum wage. Just want to show you a little bit of just two of the propaganda posters that went out at the time. So, talking about our, the cute little old man with a pipe in his mouth and how he'll get some benefits for being elderly. Yeah, man, tugging the heartstrings on mom and child. Along those same lines, depression going on, people living in shanty towns, dire situations, tough times. So this next piece is very important in the Social Security Act because this is where Title V, maternal and child welfare, comes into place. And we're focusing on that for just a minute because Title V still exists today and comes in as a block grant into the state. We'll talk about dollar amounts on that in a minute. But in 1935, maternal and child welfare was broken into Part I, maternal child health services. Part II, services for crippled children. Now, can you imagine anything being called that in this day and age? But back then, services for crippled children. Part III, child welfare, voc rehab, and administration. Part II is italicized because the services for crippled children is basically the forerunner of children with special health care needs. And just so you know, maternal child health services, each state was allocated $20,000 just flat out for that. And then there was $2,850,000. So this is for the crippled children group, $2,850,000 to be allocated among the states with that base of $20,000 given to each state. I guess in economies of scale, things are much different now. We'll talk about what is coming into the state in just a minute, but not a lot of money back in those days either. for taking care of these types of services. $1,500,000 for child welfare with $10,000 base to each state, and both rehab received in $1,938,000 of the nation to take care of those needs.
Eric, can you comment, was there a concern about polio in that time period too?
You know, polio was always a big deal, but, you know, I didn't really pull that type of information up. But I'm certainly thinking with the emphasis on crippled children and polio being so rampant, that certainly was a factor in why that was a priority. When did, and I don't even remember, what was it called, polio vaccine, when did that come out? I can't even remember. Now, public health classes aren't helping me so much right now. But so we'll Google that. We'll throw that up in just a minute. Okay. So Title VI was Public Health Work Appropriation. Title VII, Social Security Board established. Title VIII, Employment Taxes, everybody's favorite. Title IX, Tax on Employers. 10, Aid to the Blind, and 11, General Provisions. So a little bit more about Title V. Title V became a state block grant in 1981. Does anybody know what a block grant means? Okay. Comes into the state, a big old chunk of cash. It's left at the state discretion to prioritize where that money is allocated within state priorities. In 1989, they firmed that up a little bit because they felt like it was a little bit loosey-goosey with what everybody could do with that, but they wanted to leave flexibility to the states, but still provide a little bit more accountability. So that money comes into the state, and right now, the Title V block grant, our allocation for 2014 was $5,890,899, and that takes care of many of the programs within the Maternal Child Health Bureau, programs within children with special health care needs, and certainly there's other money that comes in. Programs like WIC bring additional monies in from from agriculture. So you have other monies coming in that aren't necessarily through the state block grant. The state block grant is funded through HRSA, Health Resources and Services Administration, under the Maternal Child Health Initiative, which is a bureau within that organization. Within maternal child health is children with special health care needs. We exist as a bureau, and we have for quite a long time. Our property at 4400 North Mario Kentucky Drive started out as the maternal and infant health building years ago. That was torn down, and the new building was built. It predates my tenure with children with special health care needs. So it's been there at least probably 16-ish years. And it was specifically built for children with special health care needs. HRSA defines child with special health care needs as the following: those who have or at an increased risk for chronic, physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that required by children generally. Now that can be a little bit of a flexible pool. You could walk into your doctor's office as just a regular pediatric patient, and you could leave with a new diagnosis and then kind of meet that definition of a child with special health care needs. You could have a child who's going through maybe some developmental concerns, gets into some early intervention or some services that will help to foster development in that child. The child falls into the normal range again, may not fall into that child with special health care needs definition. So it's a little bit flexible, and it allows states to kind of work within that definition of children that they target. There are 6 core system outcomes for children with special health care needs. At the end of the slide, slides I'll provide you with a final slide, and we'll make sure these are sent out to all of you. There are some resources that you can go and look at. What are these goals for children with special health care needs nationally? There are also some other links that may be of interest to you, looking at initiatives within the state, how Title V monies are spent and allocated, and some of that. So On my final slide, there's some links there, and we'll talk about that in a minute. 6 core system outcomes for children with special health care needs. First of all, the families of children with special health care needs partner decision-making regarding their child's health. And as care managers, you all know that's very important. It's certainly difficult to develop any level of compliance or improvement with the child if the family has no buy-in. So no buy-in does not, you're destined for failure. So we feel it's very important that parents are intimately involved in development of care plans and making decisions for their child with special health care needs. Important that children receive coordinated, ongoing, comprehensive care within the medical home. Important to have that place of contact that's organized and helps families to achieve what they want for their child with special health care needs. It's important that families have adequate public and or private insurance to pay for needed services. So there's great advocacy that goes on to ensure that both public and private insurances and payer sources are adequate to cover services for children with special health care needs. Very important. Children are screened early and continuously for special health care needs. And that's an important part of the care coordination piece, as you all well know. Number 5, that community-based services are organized so that families can use them easily. We want people to have access to services, but we also don't want it to be a burden for them to get into those services. We don't want it to be a roadblock to receiving continued care through those systems. And last, youth with special health care needs need to receive services necessary to make a transition to adulthood. Just talk briefly about children with special health care needs in Utah. I believe, Gina, did we say 1932 was when services started? So back when it was Crippled Children's Bureau, and we had one of those here in Salt Lake. Children with special health care needs / Crippled Children's Services began providing direct care services to children around the state. Recently, so in the last several years, and at least since I've been on board, children with special health care needs direct clinical services included the neonatal follow-up program, the Child Development Clinic, which did a lot of autism evaluation and referral, the specialty clinics, which included orthopedics and some other OTPT type clinics,
Hearing and speech.
and hearing and speech, and the itinerant clinics, which were traveling clinics that went around the state with a panel of providers who provide direct clinical services out in far-flung regions of the state. I'm sure Lori will be talking about that in a few minutes, of how that will continue. Just so you know, I've given the last 3 full years that we provided care to direct care to children in the state. Total claims of about 7,300 in 2012. 2013 total claims of just over 7,000, so a decrease of 350. 2014, 6764. We found that with static or decreasing budgets as MCH priorities shift in the state, again, it's a block grant, so that all has to be prioritized within the grand scheme of things where those monies are allocated. With some attrition of staff and inability to rehire, our ability to see children was drastically decreased. So we found that we were scaling back a little bit and trying to prioritize, but we cut back some of our itinerant clinics. We didn't hire staff that had left because of attrition. Because of that, you see some of our numbers decreasing. And because of that decreased ability to continue to provide services at the previous level, some tough decisions were made a couple of years ago. Our director of the Division of Family Health and Preparedness, Dr. Mark Babbitt, met with Dr. Ed Clark at the University of Utah and tried to broker a deal where we could leverage some of the university's resources, including a large provider group, and to see if we couldn't find a way to provide more services for kids and bring those levels up around the state. And there's a dearth of pediatric care and specialty care down in the far-flung regions of the state, up north, small towns. And so we were concerned that our ability to provide those services was shrinking drastically. And so the university was approached, and they were very gracious and very interested in contracting with us to try to provide services in an ongoing fashion. So July 1st this year, Developmental Assessment Center through the University of Utah, I don't say opened their doors, but they kind of officially started seeing kids in July, and they are housed right now at our Children's Special Health Care Needs building at 44 North Mario Kentucky Drive, and they continue to provide those clinical services that we had previously provided through Children's Special Health Care Needs. Now, there's been a rumor that Children's Special Health Care Needs went away, and that is not the case. I just want to show you kind of the before and an after of programs that are still happening through Bureau of Children with Special Health Care Needs. We used to provide clinical services. We no longer do that because Developmental Assessment Center is providing those direct services to children around the state. We did start, though, integrated services, which is our care management piece that we are doing through the Bureau. We are targeting children who live in the rural areas, who may be in a family practice or pediatric practice that is small with staff, and we're trying to help provide that care management piece and some continuity of care for those families and to provide that service for those providers so that families have the ability to coordinate care within that environment. But we still have all of those groups, and let me just tell you quickly what the acronym stands for. CHARM is Child Health and Records Management. That is a middleware program that helps disparate computer programs talk to each other and share data within the systems. The CHAT program is the Children's Hearing Aid Program. CCHD, critical congenital heart disease, CMV cytomegalovirus, EDI, early hearing detection intervention, FHCP, which is the Fostering Healthy Children program. So the care coordination that takes place from some nurses around the state for children who are in foster care. The Kurt Oscarson program, that is transplant monies that are loaned to families post-transplant who may have expenses that need to be covered, and I think they'll loan up to $10,000 with repayment or sometimes not repayment, depending on the family circumstances. Newborn screening, which is the stick, which is, I want to say, 38 current diseases or maladies are screened. The tech-dependent waiver, so that is a Medicaid waiver for children who are technologically dependent for medical services and may not meet normal Medicaid eligibility. And then the Utah Birth Defects Network. I won't go over this, but this is just a slide with mission statements for the state of Utah. And Objective 1 talks about being healthy people in the state, the Utah Department of Health mission, and the Utah Children with Special Health Care Needs mission. I'll let you read that on your own. For your hopefully better eyes than mine, there is an organizational chart of the Department of Health so you can see how everything is organized. And we'll try to give you a better slide for that. Just a list of the programs all spelled out with all of their acronyms. You can see these are the programs that remain at Children with Special Health Care Needs. And our website picture did not come up, but we have a new website. We had kind of an old one that served its purpose for a lot of years, but we've just put in a new website that has a lot of links for programs and a lot of helpful information regarding the multiple programs in the Bureau. And last but not least, these are the links I was telling you about. Every few years, a survey of children with special health care needs is conducted. This lets you see the most recent results, which was actually from 2009-2010. They have them for previous years, and if you go to the site, it lets you pull up for Utah some of the history of what took place on those surveys. So it lets you know what families are thinking about looked at Utah's allocation through the years of where Title V funding comes in from maternal child health initiatives and how that compares with other states. I have no idea what I typed there, so if you guys can figure out what that should mean, but Utah profile for Title V, here for typos, there is the link to the Bureau of Children with Special Health Care needs. You can see the current programs, and then just a maternal child health snapshot. Does anybody have any questions? All right, I think.
What do you do with the congenital heart? How does that program work?
You know, I believe that's part screening through the Utah Birth Defects Network, and I'm not sure exactly all of the Utah Birth Defects Network is a relatively complex program, and Amy Nance is the program manager for that, and I believe that falls under her purview. So I know it's a screening that they do, and they provide some follow-up as they would with any other type of reportable birth defect. Not as satisfying answer, Lori, but I can definitely find that out for you. Okay, everyone, thank you very much. I appreciate it.
I have a question.
Oh, please, please.
So I'm confused. When referring people to the development center for testing, are we going to the child development clinic or the testing center or children's health? Where does the referral go to?
The referral actually goes to Developmental Assessment Center. And as we've been getting calls, we're still not as many calls as we received initially, but we were still getting calls and referrals and faxes that come into children with special health care needs. We still forward that on to Developmental Assessment Center. Because we're in the same building, it's just a matter of walking paperwork downstairs or forwarding information on or calling Lori's staff to let them know that someone has called and made an inquiry. So right now there's no wrong door to enter.
Okay.
We'll get you to the source either way. Yes, and Lori will give you all the particulars on that.
These are children who are not in with the public health insurance. These are people who are not.
Children with special health care needs does not distinguish between whether it's public, whether it's like a Medicaid or CHIP or private insurance that runs the full spectrum. Some kids are dually covered. Other kids might be on just insurance or only Medicaid. And we've seen those kids throughout the years regardless of their source of payment and regardless of their inability to pay. Thank you, everyone. Chuck was pretty close. Yeah. Smart guy. I would do that.
Don't feel bad, so was I. I was middle school with the sugar cube.
Well, I don't know about you guys, but that was really helpful for me, and I like to think I actually know a lot about this stuff. But so now I think maybe that's at least for me a little clearer about why we are the Medical Home Portal, right? It's one of the 6 core system outcomes for children with special health needs, and again, all of those other things are things that the Medical Home Portal and hopefully pediatric practices and care management and other organizations are all trying to achieve essentially those outcomes for really all children, but specifically that group. So that was really helpful. All right, so Lori, you are up, and let's see if I can find your PowerPoint.
Oh, and I do have business cards, so I'll leave those if anyone's interested.
And here are some cards for the Developmental Assessment Center. You're welcome to take it. It has our phone number and fax on it.
Okay, great, thanks. I am so happy to be here today. Thank you so much, and I really appreciated Eric's presentation because I didn't know a lot about what you're doing now, and so it gives us lots of opportunities to work together, and you can see that we're all in this growth phase.
And we at the university really appreciate also the work that the health department has put into these programs. They are the ones that started these programs and made them what they are today. So we have big shoes to fill, and we're very appreciative of what they have done. So we call ourselves the University Developmental Assessment Center, or UDAC, because everyone needs another acronym. My name is Laurie Lesher. I've been with the university for, I think it's been 33 years now. I spent 20 plus years in the newborn ICU. I am a nurse. And then I spent the last 7 or 8 years being the director of research in the OBGYN department, so I have a good research background now. And so I have a really soft heart for children. And so this is a real great opportunity to be part of this. So our leadership team at the university is Dr. Karen Bushai, and she's been with the university for about as long as I have. She was a resident when I was in the NICU. And Sarah Winter is our medical director. She's a developmental pediatrician. And our psychology director is Sean Cunningham. We have a great staff, about 25 people, and we're very lucky to have them. So our center is a center of excellence for the evaluation of children with and at risk for developmental delays throughout the state of Utah. Very similar to the vision of the Department of Health. So these are the services that the UDAC provides, and I'm actually going to show this slide at the end too, so you can ask questions. Not all services are with every program, and really, family support services, Regina, is a support to us. We do. They're not our employees, but they we see them as a huge part of our team and a very needed part of our team. So we can talk a little bit more about these at the end if you'd like to. So we're currently running four main programs. As Eric said, we started assuming care of these services in July. And the educators. Be very transparent with all of them, and the patient goes to them as the primary care provider, really not to us.
If I could do another scenario to help me understand this as well. So a child born complex needs, doesn't meet the neonatal follow-up, but has some complex needs. I'm thinking of like the therapies. So could be referred into primary children's outpatient therapies or it can come to us. Okay.
And I think the distinguishing factor though is that it's really an evaluation center. Right. Whereas if you wanted somebody to get ongoing treatment, it would be better to.
So we're more of a diagnostic center. So we will diagnose problems and then help people find avenues and resources of help.
Along those lines, could you comment, because I think that the behavioral health, like if I have a child that comes in who's just got some really severe behaviors that we're having difficulty managing at home, and we think maybe the diagnosis isn't clear to us, and we send them to DAC. I know Sean is overseeing the psychology component. Right. Then do they not then go on to have ongoing either individual therapy or collateral therapy or family therapy there?
Not at the DAC.
Okay.
So they're referred, they will get a diagnosis at the DAC, and then they'll be referred out. Doesn't mean they don't see them. You know, they may want to see them once a year, or for a follow-up and a reevaluation, and have that relationship with their therapist. But they would be referred to, if anyone needs continuing therapy, would be referred out.
And that's consistent with how department health.
Yeah, that's how it's going.
And the results of the diagnostic testing or evaluation, is that then, do you guys have a system in place for that to come back to their primary care physician?
We do.
In the past, it feels like
We do. We
the parents are
can
bringing
share any information with the primary care physician. If the parent wants us to share any other information, they sign a waiver. If it's early intervention or the school system, and we can share with them, or we can give it to the parent and they can take it to the school system. And on the flip side, if they've had an evaluation anywhere else, we're asking them to bring that information in too, so we don't duplicate efforts.
So it's automatically now sent back to the physician who referred them?
The primary care provider, we do have a relationship with them, and we send them a summary. Most often with the traveling clinics and with neonatal follow-up.
Neuropsych testing and nurse psychology?
Yes.
So we're sending our autism evaluations to the our physicians are having a hard time with getting patients for autism evaluation.
At our center.
Or just they want to know what resources.
Okay, so you can refer your patients to us. There is a wait list right now. I think for psychology, it's a couple months out, and they do a pre-evaluation before they do the testing. And then we have to check authorization and things like that, insurance authorization, things like that. And then we're very open with the parents, let them know costs.
The DAC that?
No, you can go to private clinics also. I think we're probably the least expensive. We also work with parents using a sliding scale for payment.
You take less insurance?
We take anyone. We won't turn anyone away. Doesn't mean their insurance will always cover us. So that's why we will work with them, and we're continuing to work with several insurance companies and to give coverage.
Can you just give an idea of what the range of sliding scale, like, sometimes parents will say, well, like, what would be the most if I have to pay? Is it,
it's really hard. It's income-based. It's totally income-based. And sometimes it will pay us. They will get a 70% discount. But they have to bring in certain, they have to bring in evidence of, paychecks and, where they live, things like that. So they have to bring in information. And they can also work with our billing department. If they get a bill and they're having a hard time with it, they can work with the billing department and do payments. Oh, yeah. Okay.
More I was based on the number of specialists they've seen, so some family may see more providers in a visit, some may see less, and it will be a percentage of whatever the amount of those charges is.
Right. And we're really working hard to make sure we funnel these kids into the correct provider. We have an intake form that we're sending out and having families complete. We don't want to, we don't want to have a child see someone that they really don't need to see and then be billed for it. So we're really being cognizant of trying to make sure they see the right people.
Can you walk us through the exact, when we send a referral, the exact process? So I'm telling the family to call you, then you're sending them.
So they will call us, and we'll make a referral shelf. And this referral, we have a long waiting list, and a lot of patients we're getting through right now. So they may have to wait a couple months before we get back to them. But then we will contact them, and we'll either do it when we're on the phone with them, or we'll contact them at a later date. And we will send them an intake questionnaire and have them complete it. And we may be able to get them in for other services in the meantime, or have a pre-psych evaluation.
Okay. And so then you will schedule them until the intake questionnaires return.
For at least the exams, or to see a developmental pediatrician.
And then it's sent to them by mail or by email?
We do both. We email it, we send it by mail, any way they want it, we can fax it to them.
And is there any way that the primary care physician can be notified, like, when they're scheduled for evaluation? So that we
Probably
can
not.
There's no way of doing.
Well, I mean, that's just another step that would be, I think that'd be a relationship between the primary care physician and the patient.
Right.
You let me know when you're going in.
Okay.
I just wanted to type up with one thing though too. Any referrals that come in to children with special health care needs during the transition were forwarded to Developmental Assessment Center, and they've been working diligently to get those kids scheduled. So referrals were not lost in the process. We gave them just tons of stuff. I actually, my heart bled giving this stuff to them because I thought they've got their work cut out for them. But they've done a really great job trying to get through all that, weed through everything, and reach out to towns and try to get folks contacted. Thanks.
So, if from the office we need to send a referral, but the parents want them to call?
No, you can send a referral. Someone, yes, the pediatrician can send a referral. We'll call the parent and get more information. And the more information you can put on a referral, why you want this child seen, what your concerns are. Some of our referrals we've gotten are just blank, I'm referring this patient. And that's really hard for us to know where to even begin. We have no idea why. So the more information you can give to us, the most helpful it is.
I have a couple questions. So for psychology, are you tied in, and it's a Medicaid number, are you tied in, say, with Optum and to Valley Mental Health and to get them in? Do you guys have that connection?
Okay, not with Optum right now, but we're working on all of that. So we should be, I think our most recent, they should get looking notes about the Medicaid.
Yeah, so there's certain codes of testing that fall under the medical benefit instead of the behavioral benefit. So they don't actually bill to the prepaid mental health plan, they bill to the medical side. And those are all being covered.
But those are few, so we see very few.
But autism is one of them, which is honestly like 80% of the majority of our patients.
Okay.
Just easier.
And can anyone make a referral in? Can us as care managers make a referral in? Yeah.
You can. We want the parents to know. It's really hard to get a referral, and then we call the patient, and they have no idea why they're referred, and they don't know. And we have had patients show up, and they have no clue why they were.
So would it be better to give the number to the family and have them call you?
Or it's a good communication, or tell them why you're doing it and what your concerns are. Be very upfront, and then let us know the exact concerns. So we have this communication. Well, thank you so much. So I know that the UDAC's website is still being, it's actually all up to date. Fantastic. As of yesterday. Okay. Fantastic. Okay, so we have all, let's turn it next to the next. Okay. I think there was a little that. Oh, okay. So, I'm sorry, I didn't even finish. So part of our mission at the university, of course, is research. So we're going to be doing a lot of research projects. We're starting telehealth next year for the traveling clinic. And we have a few other programs that we're looking into. So more to come. And that's our website. That's the correct website. And so we currently have listings in the Medical Home Portal database for all the programs that you saw listed on the slides here. And we'll now go double check against the website to make sure that the information we have in there about when the clinics are happening and where and what comes along with them is up to date. But know that that's also a place you can go and find information on the individual programs and the services offered.
I know they've been fastidious too with the portal
staff of trying to get the old children with special health ratings information out of there, so that's not showing up as a resource for the clinical side of things.
Yes, we're trying to make sure that both within the portals database and on the websites of the respective organizations, things are clear. We know this has been a little confusing.
But it is really nice because if you do call the Department of Health number, they know right how to get in touch with us, so it's not like a dead end. Right.
One more question, early intervention. So if we have referrals in for early intervention to go in and do assessments from both of these kiddos, or the PCC has, are they seeing the same things and doing the same things that you would be doing?
Not necessarily, or they may. I mean, if early intervention can take care of the child, that's great. We don't need to overlap. You know, we don't need to do the same services.
But if they
want our services, we're happy to work with them. Especially in the rural communities, we work with the early intervention folks a lot. They come to the clinics.
Great.
I have one more question. Waiting time, once you get your call and do the pre-visit, and how long? Well, we have to go through the authorization process, and it can be, a couple months before it could be up to that.
Well, right now for psychology is our longest.
Yeah. Psychology is
Others could get instruments, but the insurance piece for psychology is the longest.
And most of these kids need to see psychology.
Great, great. Well, that is super appreciated. Let me come back to the slide at the end. Oh, great. Okay, so we're almost done. I want to let you get out of here. Just a couple of quick things that I didn't mention at the start. The Utah chapter of the AAP has an upcoming conference that's a free opportunity for continuing medical education. And Kathy Euler, the executive director, wanted me to make sure to let you guys know that you are very welcome to participate in this. It has to do with toxic stress and trauma. So I will send around again with our resources of the month email that goes out in a couple of days. There'll be a PDF that accompanies that is this plus a fair amount of more information. But it is coming up on October 6th. It's free, and she wants to make sure that you know as care coordinators and care managers that you are very welcome to attend that if you're interested. So watch for that coming. And then our next meeting is going to actually be at Shriners. So apologies in advance for there will be a little bit of an added drive and navigation issue for that one. But we're really excited, and so is Shriners. So they have been looking forward to hosting and presenting. And so what will happen is we'll meet there, we'll do our brainstorming part, and then they will present on what their services are and take us on a tour. So I think it'll be a really nice meeting. They're going to provide breakfast for us, so they're laying out the red carpet for us. They're really looking forward to having us there, and I think that'll be really nice. And then again, as I mentioned, we'll include quite a bit of information in the resources of the month email. I don't know if we'll actually send out PowerPoints with that, or if we'll point you to a link to where the PowerPoints are posted. But anyway, we'll make sure that you have access to what Lori and Eric presented on today. Great. All right. Well, without further ado, grab some more food on your way out. And where did Gina disappear to? She may be at the front desk. So if you want to swing by the Utah Parent Center desk, and if you didn't get a little card when you came in because the gate was up, they have cards and they'll stick validation on there for you, and then you won't have any hassle leaving.